reactions. They have what's called an EpiPen. It has epinephrine in it. You can also take antihistamines and smooth muscle relaxers. So with this anaphylactic type reaction, reacts much more strongly than you would expect. There is localized anaphylaxis, that's limited production of IgE, and the sensitization is in a local area of your body. So these are also known as allergies, asthma, hay fever, hives. Inhaled pollen would be the antigen. Then you're going to get symptoms such as sneezing, tearing, swollen membranes. An example of that type of allergy is hay fever. And if you have food allergies where you're ingesting the allergen, your GI tract symptoms are abdominal cramps, nausea, diarrhea. Systemic anaphylaxis, you have vasodilation of the blood vessels, and it causes a drop in blood pressure, and then the patient can go into shock and die. And these are associated with injected antigens, such as a bee sting. Some people are very allergic to bee stings. Those are the ones that are usually carrying an EpiPen. Penicillin, some people are allergic to penicillin. So the treatment would be epinephrine, and epinephrine constricts the blood vessels, and that helps raise the blood pressure back up again. Skin tests can be done to diagnose allergies, see what you're allergic to. They place a small amount, this person's going to be on the test, a small amount of what are they going to put in under your skin to test your allergies. They're going to put in the antigen under your skin to see if there's going to be a reaction. And if it is, you get what's called a wheal, like a positive reaction. There'll be redness and swelling and itching at the site. You can go through desensitization. That's a series of injections of small doses of the antigen. And then what they're trying to do is to have the antibody that gets produced to be IgG instead of IgE. And that IgG then can intercept and neutralize the antigen production before IgE gets produced. And IgE then, if that gets produced, then you have the symptoms of the allergy. So that's showing you one way that they do the skin test, checking for different allergies to these antigens that they're scratching in your skin, that are putting underneath your skin. Type 2 is cytotoxic reactions, and this reaction is mediated by IgG or IgM antibodies and complement. Remember, complements those 30 proteins that are always circulating in your blood. They're inactive most of the time unless they come up against something that they need to activate themselves. So injury results from antibodies that are directed at antigens on the host blood cells or tissue cells. And if complement gets fixed, complement fixation, then that can cause cell to lyse. And cytotoxic hypersensitivity reactions are caused by antigens on cells, especially the red blood cell. And then your immune system recognize them as foreign, even if they're on your cells. So antigens that cause cytotoxic reactions usually enter the body in a mismatched blood transfusion or during delivery of a Rh positive infant to an Rh negative mother. So that's what cytotoxic reactions are. Blood transfusions and the Rh factor. So an example of that would be a transfusion reaction with an incompatible blood type. So our blood system is what's called the ABO system, and that has the presence or absence of two antigens called A or B, and that accounts for these four different blood groups that we have in that system. So the letters refer to carbohydrates, this A or B. It refers to carbohydrates and that are on the red blood cell, on the surface of the red blood cell. And this A and B are actually antigens, that they're your antigen. This is kind of a strange thing when we're talking about blood, because it's against anything we thought about. So I'm just going to give you the background here so you know what's going on. So a normal individual will not produce antibodies against their own antigens. So your red blood cells have antigens on them, even though when you think of antigen, you think about something foreign that's coming into your system. But your immune system knows that those belong to you. So if the individual has either A or B antigens, or both of them, then they won't produce antibodies against those antigens. So there's a unique feature to the system, and that is that the antibodies are normally present in your blood against the A or B antigens that you don't have on your red blood cells. So these are called natural antibodies. And that means that you have antibodies that formed without any antigenic stimulation. They're just there. So in this case, the antigen is actually the carbohydrate on your blood cell that is telling you what blood type you have. And the antibodies that are in your bloodstream are antibodies against the antigens of other blood types that you don't have. So you don't have to copy this one down, just look at it, because I'll put another one up that's better for you. But blood type A has A antigen on the red blood cell, and blood type B has B antigen on the red blood cell. If you have blood type A and B, AB, then they have both the A and the B antigen on the red blood cell. And blood type O doesn't have any antigens on the red blood cell, no A, no B. So here's one that is better for you to copy. Blood type A has the A antigen, and in the plasma then circulating is an anti-B antibody. And blood type B has the B antigen on the blood cell, and anti-A antibody that's circulating in the plasma. A and B have both those A and B antigens on the blood cell, and it doesn't have